Namaste, welcome back to my channel. Today, let us have a small discussion on stroke. So, what is stroke? Stroke is a medical emergency that occurs when blood supply to the brain is reduced due to either blockage or leakage of a blood vessels, resulting in damage of brain tissue. So, when there is a insufficient blood supply to the brain due to clot or bleed, so that will damage the brain tissue. That we used to call it as a stroke. See, in this image, you can see how that blood clot reduce the blood supply to the brain. So, in these condition, patient will develop stroke. Types of stroke in the brain. There are three types. One is ischemic stroke, another one is hemorrhagic stroke, and transient ischemic attack, TIA. So these are all the three main types of stroke. See, in this image you can see due to the blood clot or hemorrhage or bleed, so the brain tissue got damaged, insufficient of blood supply to the particular area. And what are all the causes for stroke? The first thing is ischemic stroke. So ischemic stroke in the sense artery blockage, a clot or plaque buildup stop blood from reaching the brain. And transient ischemic stroke, a mini stroke is also caused by artery blockage but last only few minutes. And another one is hemorrhagic stroke. So in a hemorrhagic we can see intracranial or subarachnoid bleed. In a intracranial bleed, ruptured or leakage blood vessels, blood goes into the brain. Even in a subarachnoid hemorrhage also, ruptured or leakage blood vessels, blood surrounds the brain. So in this image you can able to understand. So there are ischemic stroke and hemorrhagic stroke. And what are all the causes for that? What are all the signs and symptoms of stroke? Fast. So what is this fast? F stand for face dropping, A stand for arm weakness, S stand for speech difficulties, T stand for time to call. So immediately stroke patient require a medical emergency. You need to call up to the ambulance and shift the patient to hospital. What are all the stroke management? So first initial 1 hour we should stabilize the patient for breathing, heart functioning, blood pressure, bleeding and swallowing. And initial diagnosis is important. Immediately CT scan or blood test to be conducted. And also personalizing treatment depend on types of stroke. Please subscribe to my channel and you can see many of the training topic in my channel. Please support to my channel. Thank you so much.